Good morning. Welcome to the teacher training workshop hosted by KidsAbility. My name is Elena Kluter and I'm an occupational therapist working for KidsAbility. I'll be sharing the topic, what is occupational therapy? First of all, I'd like for everyone in the audience to think, what is occupational therapy according to you? What do you associate with occupational therapy services? And is there anything that you can think of right now that you think occupational therapists do? I'd love to create a word bubble with everyone's opinions and collect a few opinions of different team members on what is occupational therapy. The agenda for today is we'll be discussing the definition of what is occupational therapy, looking at different models and frameworks, discuss when OT might be needed and the areas that occupational therapists work in, and also occupational therapy within the classroom. Just a disclaimer, the presentation is not intended to offer medical advice and it should not be relied upon as a substitute for a consultation with a qualified professional. Now the definition: occupational therapy is the therapeutic use of everyday life activities or occupations with individuals or groups for the purpose of enabling or enhancing participation in habits, routines within the home, within the school, within workplace or community settings. Occupational therapy services are provided for habilitation, rehabilitation and promotion of health and wellness for disabled but also for non-disabled people of all ages. So OTs assist clients with what they want to do, what they need to do, and also what they have to do. So OT is a health profession that aims to work with people holistically and consider people's strengths and weaknesses as well as their environmental factors. We work with people of all ages and all health conditions or disabilities. Okay, models are lenses which OTs look through when they're evaluating and treating clients. So this is just one of the many models that OTs can use. This explains that practitioners consider the entire person during the intervention instead of just their deficit areas. So the PEO model uses a biopsychosocial approach which takes into account the emotional, physical, and environmental factors that influence a person's occupational performance and participation. The goal is to enable participation in the different worlds which people exist in. Now we can discuss who might need OT, which different difficulties do children have who might need OT. The first category is pre-existing medical conditions that could include genetic conditions, Down syndrome, cerebral palsy, autism spectrum disorder, and also learning disabilities such as dyspraxia, dyslexia, dysgraphia, or ADHD. Also within the category of developmental delays, delayed milestones, it might be an indication of someone who might need occupational therapy intervention. Also sensory processing difficulties could benefit from OT. This could be children who show seeking or avoidant behaviors, picky eaters, could also be linked to autism spectrum disorder or ADHD. Also in the area of school-related concerns, children with handwriting difficulties, visual perceptual concerns, children who struggle with reversal of letters, copying from the board, shows difficulties with attention, and executive functioning would benefit from occupational therapy. Clients or children with mental health concerns such as anxiety, depression, personality disorders, mood disorders, and behavioral difficulties such as sleeping or eating concerns, emotional immaturities, difficulties with transitions or social interactions. Another area would be environmental adaptations. So occupational therapists would be able to help with providing different pencil grips, different sensory suitable equipment, equipment such as wheelchairs, splints, things like that within different environments for clients. OTs would also assist with skills and activities of daily living, such as cooking, cleaning, shopping, personal care, executive functioning. And the last area would be health promotion and encouraging overall positive development. So that would be sensory baby groups, bike riding and fitness groups, or family education and training. So now within pediatric occupational therapy, or occupational therapists who work with children, we look at what is the occupations of a child. So OTs who support children support them to engage and participate in their chosen occupations. So occupations in this instance can be looked at or can be thought of as different activities. So children's activities can include playing, schoolwork, dressing, feeding, reading, sports, but the main occupation for a child is to learn through play and through school. Other activities that we can include in this is coloring, tracing, throwing a ball, things that children would participate in daily. And this may be very different from an adult's occupations, but OTs can evaluate the child's skills of playing at school or school performance up to daily activities, and compare these to what is developmentally appropriate for that child's age group. So occupational therapy, the aim would be to make the most of the child's potential ability in specific areas and to increase their independence at home and school and in all of their activities. So this could include adapting the tasks or the environment and enhance the quality of life for each individual child. So now we're talking about child development, and for a child to develop sufficiently, the learning process needs to be stimulated. The child's senses need to be exposed to a variety of stimuli and needs to be in a loving, safe environment to explore. And we know that all skills and functions that occur happen as a result of our central nervous system and the processes and the way we respond to that information. So if we look at this picture below, we can see that from 0 to 7 years of age, this time span is crucial for brain development, and half of what you know throughout your lifetime you learned during your 0 to 7 years. So teachers really have one of the most influential and important jobs working with children in this time frame. During this 0 to 7 years, the brain increases in mass and also increases in the number of synapses that occur between neurons, and this enables motor actions to become more automatic and more efficient. So in this picture, you can see that up until the age of 7, kids do most of their learning and most of the building of those pathways happen. And until the age of 7, that is what the picture can show us that it looks like. So it is vital that these pathways are built correctly and following development, interaction, and stimulating experiences. So we can think of it as a highway that's being set. New highways are built, and if they're built correctly, then the paths are clear and automatic and efficient. If they are not, then a traffic jam will occur, and this will make it very hard to change and rebuild these highways or then new pathways for new skills. So the learning process starts with our senses, and my colleague will speak more on sensory integration in the next OT training workshop. But we all know we have a nervous system which receive and interpret information from the 5 senses and the 2 other senses, the vestibular or position in space sense, and also proprioception, where the information from our joints and muscles about our position, force, and awareness of our bodies in space. So the body's ability to utilize and make adaptive responses to incoming sensory information, to understand and effectively interact with people and objects throughout various environments like school and home, etc. That is what sensory processing means to the child. Now the child can respond appropriately and will experience thoughts and emotions about what he perceived. So when we look at the areas that impact occupational performance, we look at the pyramid of learning, and in order to build towards academic learning, which is right at the top of the pyramid, other building blocks need to be developed and need to be consolidated. So we view the child's development from the nervous system, which is the base, up and until academic learning. So sensory skills providing the foundation for all other skills. Development of motor skills then happens after information has already been received from the environment and the process of perception has taken place. Then only can a decision be made in relation to an appropriate response. So this can be a motor action by the body. And you can see there's a natural sequence in which skills develop in relation to one another and in which the child masters these certain skills. There's a lot of underlying skills for basic seemingly tasks. Academic learning could include handwriting, concentration, eating, dressing, all of the daily skills. But there's all these different underlying skills in this pyramid with the central nervous system as the foundational base. For some children it comes easy, and for others it takes a huge amount of effort to complete tasks, and this can then also impact their behavior. So differences lower down in the pyramid can result and often present as big challenges high up. A child needs to take part in play, in school, in self-care, chores at home and schoolwork. In order for the child to take part in these situations, they require the motor planning, perceptual skills and coordination, and an integrated nervous system, which is all lower down. And before they can appropriately use their senses, they need the developed body scheme, motor planning, coordination, and concentration, which is all in lower levels of the pyramid. Alright, different areas of intervention or areas that OTs can help with at school would be the development of different tool uses, such as scissors, pencils, things like that. And an OT might work on fine motor skills to develop these grasp and release patterns. Handwriting skills would be more than only handwriting, but also the visual perception and the visual motor integration skills that children would need, the underlying skills to be able to participate in handwriting. Something like dressing, to manage the fastening of buttons and zips and shoelaces. If there are severe delays in learning these basic tasks, such as getting dressed or brushing teeth, that is an area of intervention for occupational therapy. Motor coordination. OTs might address hand-eye coordination to improve play and school skills, copying from a blackboard and hitting or batting a ball. Then there's also sensory and attention strategies, which might help improve focus and social skills to maintain positive behaviors in different environments. Social and emotional development. Also, the OTs will evaluate the need for specialized equipment, such as wheelchairs or splints, and always use those goal-directed activities to address the participation challenges in these different areas of life. Within the classroom, children who are flagged in the classroom or are showing difficulties or concerns, they may be unable to perform daily occupational skills. So skills that are age appropriate that they have not mastered yet, such as tying shoelaces, using the utensils, having difficulty due to sensory processing and making sense of their sensory world, and show delay in development, so insufficient gross motor or fine motor skills, and battling to maintain their balance or posture at school, showing poor writing and cutting skills, insufficient visual perception skills such as learning to read or write and having trouble with that. Also insufficient concentration skills, or they battle with attention problems. Children with children that have any of these observable or even basic skills, there could be a lot of skills that are not consolidated yet for this child. So we can think, what kind of behaviors are you seeing in your class that are concerning to you, and what type of signs can teachers pick up on at school? So this list is by no means exhaustive, and we can look at a few different signs in different areas. So for gross motor skills are necessary for a stable posture, for skipping, running, for riding a bike. When children have difficulties within their daily activities because of a motor problem, it's hard for them to fully participate in things that they need to do or want to do or expected to do at home or at school or in the community. So this is an area where occupational therapists can help the teachers and the parents to better understand what intervention does the child need to succeed with their everyday activities. So different signs for gross motor skills could be children that move stiffly when they're participating in play or outside gross motor play. They are not moving as coordinated as some of the other children that are their age. They're moving constantly, perhaps, to the point that it interferes in their daily learning. They can seem to have really weak muscles. They can have a poor posture, slouching at the table throughout the day. Some children can come across as really clumsy and constantly falls down or bumps into other friends. They can battle to learn a new motor skill and find this very hard. Right. Also, in the fine motor skills category, fine motor skills are important for daily tasks such as printing, drawing, cutting with scissors, self-care activities, and the certain signs that teachers can pick up at school can be messy, illegible handwriting. It can be poor performance in writing tasks, confusion of left and right hands, or swapping hands during activities, not constantly using one hand to do a drawing task. Poor hand strength can be something concerning. Children who are unable to perform their daily dressing or opening lids or opening containers. Children who have problem tying their own shoelaces when it is age appropriate, or children who hold pencils really tightly and presses so hard that they show pain in their arm or in their hands. And then in the organization skills category, the signs to look out for in children could be children constantly forgetting their belongings or daydreaming the whole day in class. They're not remembering their assignments or homework, and they're unable to do that independently, or children who have real difficulties to follow directions. Perceptual skills could look like children showing poor performance in reading, spelling, or maths, problems reading from the board, trouble telling left from right, looking at different writing errors such as letter reversals, or write mirror images of letters. They also have difficulty distinguishing similar letters and shapes, or they could also show poor organization of the words and sentences that they write. Then, as I said before, this list is definitely not complete, and we can talk about different signs in a classroom or concerning signs for a long time. But what we can still add is also emotional difficulties, behavioral challenges, processing difficulties, things like impulsivity or high energy levels that are concerning, and other regulation skills such as a low frustration tolerance, and other signs such as children becoming agitated when they are touched, or putting objects in their mouths constantly or frequently, children who avoid messy play or avoid swings and slides or heights and moving activities, children who dislike noisy places, or they're really bothered by background noises, and picky eaters, or children who limit their food preferences. Alright, so if any of these concerning signs have come up as difficulties that the child show with daily activities, it's hard for the child to fully participate in things that they need to do, want to do, or expected to do in their different settings, and it's hard for them to participate in the occupations or the activities that we've discussed that are meaningful to them, such as play, learning, schoolwork, and any other leisure activities in different settings. Then the evaluation process needs to be considered. So when a child is referred to occupational therapy due to some of these concerns at home or at school, the first step would be an initial consultation with the child's parents. In this consultation session, the client's history and short and long-term goals can be established, which creates information about the client's strengths and weaknesses, and a screening will likely be done to determine whether an assessment is appropriate for this child, or whether occupational therapy services is appropriate, or whether there's another professional who is more appropriate at this time. So this will also work with gaining more information, or more gathering more information from other caregivers, teachers, and other team members which are appropriate. After all of this information is gathered, and an OT assessment or evaluation will take place, and within this assessment, standardized and non-standardized tests or informal interviews and clinical observations are used to evaluate all the underlying skills that is needed to carry out the tasks, and to identify where the difficulties are coming from that this child is struggling with. Also, prior to coming in, families will complete paperwork about the child's medical history, birth history, and developmental history, and the areas of concern. After the assessment, the OT and the parents, as well as the client, depending on the child's age, will together decide on the occupational goals for the client. So this could include strategies in the classroom, environmental adaptations, and also education. Then there will be decisions about the type of intervention, implementation at school, at home, or in the clinic, and also the duration of sessions. And after that, the OTs will continue to use goal-directed activities to then address these participation challenges in the areas of life that are meaningful and important to this child. Alright, but what is important to consider is that we are all unique, and every child is unique. So where there are concerns for a child, we need a better understanding first of the child, and then we can facilitate and enhance their participation and performance in their preferred occupations. So however, support is available, and we have to consider early intervention, as we've discussed today, but we also need to remember that every child develops according to their own pace. So an occupational therapist is someone that could be part of that support team for a child, although we work with so many other professionals as well, and a child who does need support will always have a full support team. So some of the other team members this is not limited to, but also includes teachers, speech and language therapists, clinical social workers, clinical psychologists, counselors, parents, and also to this list I can include behavioral optometrists and audiologists, and of course the treating physician of that child. And very importantly, also the child will be part of this team. I hope that you've learned something about occupational therapists and what we do. There will now be a time for questions, but if you're watching this video, then please contact us with any questions, and thank you for attending today. All right. Thank you. We appreciate you attending.